High-risk women should be tested to detect low bone density before fractures occur. This dual-energy X-ray scan or DEXA can measure density in the spine, hip, and wrist, the major sites for fracture. The scores are then matched according to World Health Organization guidelines.
For any given region, here you've been scored to lie just in the green region, which puts you in the normal region for the whole exam, for the whole examination. If you were to lie in the yellow, then you would be considered osteopenic, and in the red here you'd be osteoporotic. We note that in the neck region your T-score is actually minus 1.5, which means you're at the borderline of osteoporosis in that region.
Osteoporosis is a silent risk factor for fracture, just as hypertension is for stroke.
In Asia itself, the population is aging quite rapidly. It is estimated that in the next 50 years, half the hip fractures in the world will come from Asia. And this is actually will carry a significant economic burden to the countries involved.
Whether or not you're at high risk, you can take steps to protect your bones at any age. Today, bone surgeons have more options for a diagnosis and treatment. Magnetic resonance imaging uses radio and magnetic fields to pinpoint problems of the bones and joints when X-ray results are not clear.
Nowadays, we have a new modality of treatment for vertebral fractures, which is called vertebral kyphoplasty. Now, in vertebral kyphoplasty, we use a cannula, right? For example, like this, which is hollow. We introduce it into the vertebral body under X-ray control. Basically, what we do under general anesthetic, okay, is to put a cannula, two cannulas into the bone with the use of X-rays. Use a balloon filled with contrast medium to expand within the bone itself, pushing the vertebra open, reducing the fracture, and then taking the balloon out and inserting bone cement into the substance of the bone itself. Subsequently, once the bone cement has hardened, the cannula is removed and we are left with this cavity that's filled with bone cement. Okay. The advantage of doing this is that it's a small procedure. It doesn't involve major surgery, and the patient has very rapid relief of pain, thereby getting back on her feet rapidly.
Calcium is needed for healthy bones, and it's never been easier to get enough of the mineral from food or supplements.
Most importantly, stop smoking if you're a smoker. Decrease alcohol intake. Calcium can be taken in form of foods, dairy products, milk or skim milk, yogurt, tofu, okay, sardines. You eat the whole sardine with the bones. Those are high sources of calcium as well.
A strong bones diet should also include proteins to help you stay in shape.
Some patients who are elderly, they lose appetite. Right? They lose appetite, they decrease their protein intake. And it has been shown, protein malnutrition leads to falls because your muscles grow weaker, you become more unsteady, okay, and then you tend to fall down.
Regular physical activity has been associated with many health benefits. And after the break,